Before we get to that, just a quick reminder of the WhatsApp that you can use to send in your questions. It is +251 94 550 2310. +251 94 550 2310. But as usual, we're happy to talk to you live and also to take your questions that you might want to put through our question and answer section. We are coming to you in English and French, so please feel free to select the language of your choice. For the moment, though, let me bring in the acting director of the Africa CDC, Dr. Ahmed Ogwell, for his briefing for today. Ahmed, good morning, and it's over to you.
Thank you very much, Wayne. Good morning, good afternoon, good evening, wherever you're joining us from. Welcome to our weekly press briefing on public health events here in Africa. Let me start by today on the continent, we are actively following up 9 different public health events. That is 9 different public health events that we are following up. We are actively involved on the ground in 4 of those. We will be sharing a little bit of detail on at least 4 of those that we are following up here on the continent. The rest, we are working closely with the affected member states because they already have capacity, and we are providing remote technical assistance and medical countermeasures as may be required. So of the different public health events that we are actively following on the continent, they include COVID-19. They include Marburg virus disease, the outbreak that is in Equatorial Guinea, diphtheria in Nigeria, monkeypox in multiple countries, cholera also in multiple countries, Lassa fever in multiple countries, measles in multiple countries, dengue in Senegal, the flooding in Mozambique, and the 10th is the Sudan Ebola virus disease that we are now monitoring post declaring it over in Uganda. So these are the 10 that we are actively following up. The ones that we'll talk about today are COVID, Marburg, diphtheria, and cholera. And I'll start with COVID. As of today, 12.4 million cases that we've documented on the continent, and this accounts for 2% of the global cases that have been reported across the world. We have unfortunately lost 256,705 individuals here on the continent, which gives us a case fatality rate of 2.1%, still double the global average. And these numbers constitute just over 4.1% of the deaths that have been reported due to COVID globally. Recovery is at 95% of those that have been exposed. While we look at the weekly update and trends, when we compare the current epidemiological week 6 with week 5, we see that the number of new cases that we documented during week 6 were 1,256 new cases on the continent. And this is a 72% decrease when we compare it with AP week 5, when we had over 4,500 cases. Looking at deaths, during AP week 6, we have documented 12 new deaths as a result of COVID here in Africa, which is a 20% increase when we compare with AP week 5, when we had 10 new deaths. But when we look at the 4-week trend analysis, we see that for new cases, we have documented a 47% decrease for COVID-19, while the number of new deaths, we have documented 5% decrease. for deaths attributed to COVID-19. So the general trend on the continent now is quite flat, with indications that we may be seeing further decreases in numbers and also in deaths. Vaccination continues across the continent. We have received 1.081 billion doses of COVID-19 vaccines, and we have administered 900 million, giving us 83% administration rate for those COVID-19 vaccines that we have received here on the continent. In terms of coverage, we are now at 43.91% of the eligible population, and for us, that is 12 years and above. And this is just under 408 million people that have been fully vaccinated on the continent of those who are 12 years and above. For boosters, we are still at 4.86%. We increased in the last week just over 64,000 individuals who've gotten their extra boosters. And right now we stand at 45.1 million of those in Africa who have gotten their boosters. And we encourage really that we continue to get our boosters for those who already are vaccinated and are eligible. And for those who are not vaccinated, we encourage them to get vaccinated. What we are seeing with these numbers of COVID-19 vaccines is that due to the slowdown in active campaigns, the numbers have decreased, and also due to the holiday season, we also saw those numbers coming down, and right now we are trying to bring them up once again. We are seeing that countries who have targeted drives for particularly the youth, whether it is in institutions or in the general public, those numbers increase more than where there are no targeted campaigns in a country. And this is because Africa is largely youthful. And so when we target the youth, we target a very significant proportion of our population. Our recommendation is one, that every COVID-19 vaccine that has already been given emergency use licensing is good for you. Don't choose vaccines unless there are special reasons. Do not choose vaccines. Please get the vaccine that is available. All vaccines that have been given emergency use licensing are good for you. Second is we are really encouraging people to get their booster doses for those who already have been fully vaccinated. And third, we are encouraging targeted campaigns, whether it is to health workers, it is those with comorbidities, or it is to the youth. We are targeting, we are encouraging targeted drives so that we get the numbers going up and the general public being more and more protected. Under our Saving Lives and Livelihoods program, we still have 49 countries that we are engaging out of the 55, and out of those 19 are actively implementing this particular program. We have now increased by over 200,000 since the last briefing, and the Saving Lives and Livelihoods program stands at over 12.8 million doses facilitated across the continent. We are quite proud of this area of work because it has driven up the proportion of those who are fully vaccinated from the lows of 20s that we were seeing some months back to now almost reaching 50%. So COVID-19, our mainstay right now is vaccination, and we are looking forward to the numbers on the continent increasing more and more each week. The second is Marburg virus disease outbreak in Equatorial Guinea. You will recall that the Ministry of Health and Social Welfare of Equatorial Guinea did announce on the 13th of February a confirmed outbreak of Marburg virus in its northwestern province called Kientem. Out of all the cases that have been tested in the laboratory, one case has been confirmed. 9 deaths have also been documented. To date, we have 21 individuals in isolation as we continue with the testing for those samples. The mainstay right now is limiting movement, providing information to members of the public, and ensuring that all those who have symptoms that are similar to those that were reported in the beginning, including fever, fatigue, some blood-stained vomiting and diarrhea, they are all being provided the opportunity to be tested and also being given special isolation units where they are being looked after as we continue with the testing. No new case has been laboratory confirmed so far. We, as Africa CDC, have deployed a team of experts to Equatorial Guinea who are right now supporting the Ministry of Health and the government of Equatorial Guinea in coming up with a good plan of mitigating this particular outbreak. We are also working very closely with Equatorial Guinea's neighbors, particularly Cameroon and Gabon, because the area it borders both countries. So we are working very closely with those two countries to ensure that we limit the risks of cross-border spillover for this particular case. One big challenge we have are test kits, and we as Africa CDC are working around the clock to try and get test kits to Equatorial Guinea and also to Cameroon and Gabon to ensure that we have a very short turnaround time for samples being tested in the laboratory. This is a very important time because we have a lot of experience now with hemorrhagic fevers, and we want to make sure that we bring all that experience to bear in Equatorial Guinea so that we arrest this outbreak as soon as possible. The third that I'll share today is diphtheria in Nigeria. Since the last update, we have documented 616, that is 616 new cases of diphtheria, including 2 new deaths, and all of them in Nigeria. Cumulatively, since the beginning of this particular outbreak, 5 states in Nigeria have reported a total of 739 cases, with 40 deaths in total so far. Over 80% actually of the cases that we are seeing, that we're reporting for the last 1 week, are in very young people, 2 to 14-year-olds, and this is very much linked to the poor vaccination coverage that is a result of one of the results of the COVID-19 pandemic, when routine immunization was disrupted. And that's why you see so many cases in the young people who may have missed out on vaccination in the years past. And we are seeing also that of the number of cases, the vast majority are in areas where the disruption occurred. And so we are also working with the government of Nigeria to see how we close the gap of vaccination for diphtheria. A team has been put in place by the government there, and we are supporting that team remotely through our regional office, which is based at the West Africa Health Organization in Abuja. The fourth and final one that I will share today is cholera. Cholera, since the last briefing, we have just over 11,260 new cases and 322 new deaths from 8 of our AU member states. And these are Burundi, Ethiopia, Kenya, Malawi, Mozambique, Somalia, South Africa, and Zambia. Since the beginning of this outbreak, we have documented, for this year, 2023, we have documented about 33,000 cases and just over 1,000 deaths for cholera in about 10 countries. And this means that we are actually losing 3 people out of every 100 cases for cholera. And we want to roll this back as quickly as possible. It is also worthy to note that of all the cases that we have reported here, 76% of them are actually being reported from Malawi. And there is, of course, a likelihood that the neighbors that are reporting cases, including South Africa, Mozambique, Zambia, it could be possible that they will spill over across the borders. We are still studying that very carefully to ensure that we know the sources of these outbreaks in the neighboring countries and elsewhere on the continent of Africa. So when we look at Malawi in a little bit of detail, we see that since the last update, we have documented 9,000 new cases and 292 new deaths, giving us a case fatality rate of 3.3%. It is also important to note that since the beginning of the outbreak in March of 2022, in Malawi, we have documented over 44,000 cases, and the outbreak has been reported in 29 of the districts in Malawi. This tells you that it is across the country. On the 13th of February, though, His Excellency, the President of Malawi, Mr. Lazarus Chakwera, launched the End Cholera campaign, where he galvanized the public and stakeholders to come together to increase the momentum for support to the response efforts in that country. Africa CDC participated, and we have a team on the ground that continues to support the government of Malawi in its efforts. Indeed, in the coming days, we are also going to send a team to Zambia upon the request of the government there, so that we can support them in bringing under control their own outbreak, where the numbers have been increasing. So far, we have 125 cases that have been documented in Zambia. And although 2 of those confirmed cases had travel history, Malawi and Mozambique, the local numbers need to also be brought under control. So we are actively involved in this cholera outbreak in Malawi, and shortly we'll also be in Zambia upon invitation. All the other countries, we are providing them with capacity building, remote support for countermeasures as we watch how the countries are handling, and if they need extra help, we will be able to provide that as quickly as possible. Then let me go to a few announcements. First is on, you will recall that we talked about an unknown flu-like disease that was in China and had been documented in African citizens from one country who had traveled there recently, that is Nigeria. We have been regularly in touch with both countries, and we can say that that particular situation is now resolved, and the bilateral communication that has been going on between China and Nigeria have been successful, and so it is no longer a public health event of concern for us here at Africa CDC. The second announcement I would like to make is our side event during this summit. This is the Africa CDC Ministerial Executive Leadership Program. We are having a forum on the 18th of February, and that is this Saturday, starting at 7 a.m. East African time, where we are bringing together ministers of health from across the continent to discuss how they can be more effective in providing transformative leadership through the new public health order. It will be a whole day event. It will be a closed event, except for the opening ceremony in the morning at 7, which will involve now confirmed 11 heads of states who have confirmed attendance for that 18th meeting, where they will give solidarity messages to the health ministers. And the rest of the day will be a closed session where we'll be discussing with the ministers, how do we refine our political strategy? How do we refine our leadership on the continent under the new public health order, so that we are more ready for any health security issues that may come into the future. A link is going to be shared for that opening session, where we expect to stream it live for you to also be able to hear the solidarity messages from our heads of states. Secondly is, as we try to accelerate implementation of our Bingwa initiative, these are the youth across the continent, we have opened the call for application for Southern and Western Africa regions, and we intend to pick 100 young people from each region. So that is up on our website for Southern and Western Africa young people to make applications, and we are looking forward to their participation in the AU, the Africa CDC AU Bingwa initiative. I would also like to make some clarification on the statement that we issued yesterday on the pandemic fund. I would like to be clear that we are not, and we were not criticizing the pandemic fund. We were making our position known that the call has been opened. The pandemic fund is a very important new tool, particularly for us here on the continent. And we are encouraging our African countries to express their interest and, in fact, make applications to the fund. But Africa CDC, due to the nature of our status right now, we are not able to compete as a recipient. We can only be able to make our applications as an implementing entity, because that is our role. We cannot be given the role of coordination and then we go and we start presenting ourselves to the world as only implementers. We are not implementers, we are coordinators. And therefore, our new status does not give us the latitude of going to be an implementer and a recipient. We can only go out in our status of coordinators of the continent's health security efforts and also conveners of our member states. So whatever we receive on behalf of the member states and not just ourselves. That is the message of the statement yesterday. And we made it public because there are so many questions that are coming in from so many different institutions, members of the public, the media, and we wanted that to be clear once and for all. We are not criticizing the fund. We are just unable, and we are very sad about it. We are unable to participate because of the status that we have and because we have not yet been accredited as an implementing partner by the fund. Finally, is during this summit we've been holding, we have been and we are continuing to hold various bilateral meetings with partners and our member states, all in an effort to strengthen our collaboration with the different sectors of health, the different member states, and our interest is to make sure that our mandate that goes beyond health emergencies is not only understood, but we craft partnerships and collaborations that are going to be benefiting the continent. And we've had good conversations around manufacturing. We've had good conversation around TB, around HIV, around malaria, and we continue to expand those collaborations with different member states and different partners during this time. We'll give a comprehensive brief on this next week after we've had all the meetings, and we'll also share the way forward that has come out of those meetings during this summit. Thank you very much, and back to you, Wade.
Thank you, Ahmed. Our first question is coming from Coletta, but I'm just seeing that Coletta has put up her hand. So perhaps she prefers to come through live instead of the WhatsApp questions. Coletta, do you want to speak live, or should I read out your questions for you?
If it's okay, I can speak out the questions. That's okay.
Did you say you want to ask the questions, or I can read them out?
I can ask the questions, Madam, if that's okay.
Please go ahead. Please go ahead, Coletta.
Okay, thank you very much, Madam Wine, and thank you, Dr. Ari. My name is Coletta Wanjohi. I'm now with TRT Africa. Doctor, I'd like to kindly seek your indulgence of the fact that the World Trade Organization members extended the deadline to establish whether the TRIPS waiver should be extended to COVID-19 diagnostics and therapeutics. How much does that push us back, if that's the case, in terms of the continent striving to have its own self-dependence in terms of production of our own therapeutics and diagnostics? Then secondly, if you could kindly shed more light on Marburg. What do we need to know generally? Is there a danger of the spread? And what lessons can we learn from countries that have really succeeded in flushing out the disease in previous times? Thank you.
Thank you very much, Colette. On the question of the extended deadline on TRIPS flexibilities at WTO, we are very keen that agreements are made in a way that makes it possible for African countries to access intellectual property at the time of need. Our position has always been that we have the TRIPS agreements, and the flexibilities that are in the TRIPS agreements are self-executing, and they should be allowed to be implemented immediately we have a public health event of international concern, or for us here on the continent, as soon as we have a public health emergency of continental security. These agreements are clear, and what is required is implemented. We can discuss dates and deadlines of the flexibilities under TRIPS agreement was for speed when there is a public health emergency. And it is still our position today that the TRIPS flexibilities should be allowed to be implemented as is, without pushing dates further and further away from a public health emergency. Secondly, on Marburg, Marburg is a hemorrhagic fever. So pretty much in the same way of Ebola, the risks, transmission routes and the risks are very similar. We've had experiences across the continent, most recently in Uganda and Ghana, and we have a lot of experience on how to manage this particular virus when the outbreak gets into the human population. We are bringing that experience to bear. At the moment, we do not see a risk beyond the community that is affected, and we are working with the government of Equatorial Guinea to keep that particular risk low. We are also working with the governments of Cameroon and that of Gabon to limit any spillover across the borders. And you know, these are rural communities, and so borders sometimes are not as easy to identify, but we are working with the communities around there to ensure that it doesn't spill over. In terms of what the members of the public should do, just like in the case of Ebola, we need to ensure that anyone who shows any of the symptoms, whether it is fever, it is vomiting, unexplained fatigue, they should get medical attention quickly. And members of the public should not expose themselves to those who are unwell until they have been managed. We should, at the same time, and this is to us as African CDC and the government, ensure that our testing capacities have been increased. We are doing that right now, procuring a lot of test kits so that we can be able to have quick turnaround time for any suspected case. So we should be able to make those available as close to the epicenter as possible. And thirdly, we are doing a careful sequencing of the samples to see what the source of this particular outbreak this time actually is. It will help with limiting risks within the community and beyond. So exactly the same advice we've been giving for Ebola is what we are giving for Marburg. And we are working very closely with the three governments to ensure that we keep this outbreak as small as possible. Thank you.
Thank you, Ahmed. The next question is coming from Kara Anna. In fact, she has two questions, and she is with Associated Press. So the first question, which is split into a number of questions, she says, what does it mean when you say that countries with cholera outbreaks do not have immediate access to vaccines? Do you mean that they have no vaccines at all, or is there some delay? And if so, how long is the delay? So that's one question. Now we go on to question number 2. Have Mpox vaccines arrived in any African countries as yet? And which ones? And if they have not yet arrived, when will they arrive?
Yeah, no, thank you. Thank you, Kara. When I say there's no immediate access, it is that production is actually going on, and the production is not enough to be able to meet the demand because of the multiple outbreaks across the world. And here on the continent, the countries have not yet, they had a stockpile, which is finished, and now we are waiting for the next round. So they don't have them physically, but it is on a list. As the production continues, then countries based on their list are going to be receiving those doses of cholera vaccines. The delay is something that is very difficult to predict right now, and we'll come back to you with that, with the latest information, because we have not followed very closely how soon they will get that. Counterparts in WHO have been doing that close follow-up. So production is going on, but it is not yet at country level. Mpox vaccines have not yet arrived on the continent, and we are working very closely with our partners, and we hope that in another 2 weeks tops, we should be able to get the Mpox vaccines here on the continent. Which countries will receive first will depend on those that are more acute in terms of numbers and the increase in the numbers of new cases and the overall burden of each and every country. That is not, it has been quite stable. It has not been changing a lot, but at the time of arrival of the vaccines, those are the criteria that we'll use to be able to take them to the countries where there is more acute need and there's a bigger burden for Mpox infections. Thank you.
All right, thank you. We have questions from Sarah Jerving, who is with DEVEX. So Sarah says, can you please let us know at what points during the AU summit will there be news on Africa's health institutions, in particular news on Africa's CDC's next steps on operationalization of autonomy, such as the announcement of the new Director General or approvals of frameworks and the Africa Epidemic Fund? And she also wants to know any news that you might have on the Africa Medicines Agency. Then she goes on to say, how will news on these two institutions that comes out of the summit be communicated to the public? I could also support with information on that. And finally, she says, will there be a press conference on this as there was last February? So that's quite a number of questions for you coming from Sarah.
Yeah, no, thanks. Thank you, Sarah. And on the issue of how it will be communicated to the public, Wayne is here. That is exactly her role. She will explain that. Now, at what point will we know of the outcomes of Africa, both Africa CDC and Ouma? We will know at the point of closure of the summit on Sunday evening. And all communication around all the items that are being discussed are going to come out after the summit has closed. On Ouma, it is the same path, that discussions continue until the closure of the summit. And at the closure of the summit is when we will know the next steps for Ouma as well. Of course, Africa CDC's steps are a little bit farther than those of Ouma, but all that is going to be made available, going to be known and made available at the end of the summit. On communication to the public, I will leave that to Madam Wayne, because that's the role of her department. Madam Wayne.
Thank you very much. Sarah, we would be communicating such information through our digital platforms mostly, and those would be the website of the African Union, the website of the Africa CDC, and the social media platforms of both. So if you can just look out for that. The programs for the summit are out and they are on the website, and that will guide you to know when those particular issues are going to be discussed. But normally the information would come out publicly once all the decisions have been adopted. So we will be liaising very closely with the Africa CDC. Together, we will then decide on the release of that information as soon as it is made available. If a briefing is then called, we are running a number of press briefings during the summit. So if a press briefing is called, then that would also be another avenue for the release of that information. I hope that helps. Please do go to the African Union website so that you can follow the program and you can know when the issues are being discussed. And then the communication teams would be in a position to release that information. I hope that that helps, but if you have any further questions, please let's continue talking. Neke is also online, and I think you have his numbers, and you also have the number of the WhatsApp group that we use to coordinate these press briefings of the Africa CDC, so you could also check through that. All right, now we go back to Kara Anna, and this is an old one actually. The one on Mpox, I think it has come again. Sarah Jerving, do you have a question? I see that you have your hand up. Do you have a follow-up question? Hello, Sarah. Sarah, do you have a follow-up question, or is that an old hand?
Oh, can you hear me?
Yes, we can hear you.
Okay, sorry about that. Thank you so much for that clarification on the AU Summit. I do have another question. Dr. Ahmed, I'm making the assumption that your comments on the pandemic fund are in reference to a title of a story we wrote yesterday, which included the word criticism, which kind of speaks to the criticisms of exclusion as an implementing entity, but not of the fund itself. So your statement does say that, quote, this has considerably constrained the ability of Africa CDC in the context of the pandemic fund to play its AU mandated role as convener and coordinator of health security in Africa, end quote. So I'm not sure how that statement isn't making a point that there are structural changes needed, which is a criticism of the current exclusion of Africa CDC as an implementing agency or entity. Thank you.
Yeah, no, thank you. Thank you, Sarah. Our role is coordinating our member states and stakeholders' response on the continent. And also our role is convening our member states and acting as, if you want, a recipient on behalf of the member states, not ourselves. When we are not able to be an implementing entity because the process is not complete and the call has come ahead of our request to be an implementing entity being considered, it means that this particular call, we are therefore unable to act in the way that we've been mandated. And that's the constraint that we have. We want to do it, but we are unable to do it because we are not an implementing entity. If we are granted the status of an implementing entity, then we can interface with the pandemic fund on behalf of our member states in a more effective way. Right now, we cannot be able to interface with the pandemic fund in the way that our mandate calls us to act, because we don't have the status of an implementing entity. So that is the constraint that we have, and we wanted to make sure that everyone understands why Africa CDC will not be, during this first call, acting on behalf of the member states, because we don't have that status under the pandemic fund's current structure. So that's the position that we wanted to ensure that is clear. But as soon as we become an implementing entity, we will be playing our role of an interface between the pandemic fund and our member states. But we are unable to do that now because we are constrained by the fact that we are not an implementing entity.
All right, thank you. I have an explanation now as to why Kara Anna's question has come back. There's a comment that it was not answered. So the question is, have Mpox vaccines arrived in any African country as yet, and which ones? And if not, when will they arrive?
Kara, Mpox vaccines have not yet arrived on the continent through the efforts that we are making. We do not have a clear timeline yet, but we are working with the next 2 weeks so that we can get those onto the continent. I'd also said that we will be distributing these vaccines based on acute need, meaning new cases. And second, criteria will be the burden. That means the total number of cases that a country has. But no Mpox vaccines have yet arrived here on the continent.
Okay, I'm not seeing any more questions coming up. But before we go, I'd just like to make reference to the cholera challenge that is being faced in some countries. And I'm aware that in those particular countries, there is a lot of flooding going on because of huge amounts of rain coming down. So my question would be, what advice could be given to those countries? Let's say they expect that they might have flooding coming up. What sort of measures can be taken up to make sure that the challenge of cholera is reduced or minimized?
No, thank you. Thank you, Wayne, for that. And in fact, during this time, particularly the southern part of Africa, it is the rainy season. And as you can see from Mozambique, we already have quite a lot of flooding as a result of a lot of rain that they are receiving, all related to climate change, of course. There are several things that a country can be able to do, even the public can be able to do to mitigate the risks. First is flooding is difficult to predict, but the path of flooding is known by all of the governments, depending on where rivers and large water bodies are. So the first thing is to ensure that there is a plan of rapidly evacuating individuals when the rains become sustained before the flooding becomes a reality. And usually you have a very short window of hours, at best a day, to do that evacuation. So you must have a plan because you can't stop the rain from coming. Second is for cities and towns that are a little bit away from the center of the flood, our drainage systems must be made to function properly so that there is no blockage that will make flooding worse. Because in towns and cities, you find that the sewage systems are designed in a way that if they burst, then they easily mix with our safe water sources. and systems as well. So when you get that right, and your cities and towns can be able to manage large volumes of water, then you reduce those risks. Third is getting your health system ready. You get your health facilities ready. You get your health workers ready. You get your vaccines where, for example, in cholera, you get your cholera vaccines stockpiled and ready. You get your treatments stockpiled and ready. So that if something does come, you are not losing people as you scramble to look for these medical and health products. So preparedness is key, because we know it is going to rain. We don't know how much it will be, but getting prepared is very important. So all stakeholders involved in the whole chain must be ready now before the flooding actually comes. Finally is coordination. And this is our role as Africa CDC, coordination across countries. We are engaging with all the countries in the areas where we see risks of flooding are present, and working with them so that we put all these mitigating measures in place before the actual event comes, or in this situation spreads for some countries where the flooding is already happening. For members of the public, right now is being super awake. If you're in an area which is low-lying or next to a water body, it is being super awake to the fact that you may need to evacuate at a moment's notice. This is very important so that we don't get people getting caught out, lives being lost, or people being marooned in areas that are very difficult to access as a result of the high water. Preparedness is what we need to do as individuals, as a public, and as governments.
Thank you very much for that. Sarah Jerving has come back, and she says, if there is an announcement of the Director General made at this summit, how soon will that person take on the role? Is it instant, or is there a time period following before that person takes on that role?
Well, thank you, Sarah. This is more a question for HR than Africa CDC, but there will always be a process of onboarding any new senior staff of the Africa Union. And this process can take anything from days to weeks. So it's very difficult to predict. Our expectation is that upon the announcement of a new Director General, the time taken for that individual to be formally installed will be as short as possible, because it is one of the key parts of operationalization of Africa CDC. So I cannot be able to give you timelines, but I can tell you that it is our expectation that it will take as short a time as possible for that transition to happen.
All right. Thank you, Ahmed. I don't see any more questions coming up, and we are almost at the top of the hour. So, Sarah, you want to? Okay, your hand has just gone down. So perhaps this is the time for us to give you to give us your 3 main points that you want colleagues to take away from the briefing.
Yes, no, thank you very much, Wayne, and thank you very much to all those who have joined us today. So my 3 points today, and then one overarching message. The 3 points for COVID is, let us support the integration efforts that many governments are currently operationalizing, so that we come out of campaign mode for COVID-19 vaccination into integrating COVID-19 vaccination into the routine vaccination and immunization programs at country level. Let's support that by ensuring that we are accessing those vaccines when they are made available. And let's take our doses, whether it is first or second or booster, let's take our doses and protect ourselves. So that is on COVID-19 and integration into the regular health system for immunization in countries. Second is around Marburg virus disease. We have an outbreak. It is in a community that is near borders of 2 other countries. This should not cause panic. We are working very closely with the 3 governments to ensure that it is contained in the community where it is, and reducing the risks for the rest of the country, indeed the rest of the continent. So although we have low numbers at the moment, we continue to do testing for suspected cases so that we have a clear understanding of what the burden of disease are, and we are managing those who have symptoms that are suspected to be those of Marburg virus disease. There is an outbreak. Do not panic. It is being worked on to be brought under control. Third message is on cholera. We must have a high index of suspicion for our surroundings, whether they are safe or not. And the safety is around water bodies. The safety is around sources of water, where whatever it is that we are consuming. The safety is around how we dispose of our waste. We must have a high index of suspicion for a safe environment. And this must be done by ourselves individually so that we help the system to keep the numbers low. We are going to be providing as much support as we can, but we need to have that safe environment that we must create ourselves and sustain based on advice that is coming from government. The overall message that ties all these 3 is climate change. And we are seeing more and more outbreaks. We already have 10 we are dealing with currently, and it is only the 2nd month of the year. And all these are linked to climate change. We must bring the tackling of climate change to the core of our preparedness for health emergencies and disease threats, because climate change is a real challenge for us here on the continent. And that is why we are seeing viruses that are usually amongst the animal populations coming into the human population because of human animal conflict, fighting for space, because of flooding, because of drought, and all the other effects of climate change are making it easier for viruses from the animal population to reach the human population, and making it more difficult for us to be able to bring it under control. So climate change is the overarching message, and we really want that this is brought to the center of the discussion on how to mitigate the risks that come about during disease threats and health emergencies in relation to climate change. And thank you very much, Madam Wei.
All right. Thank you very much. Before we close, 2 quick announcements. The first is some advice, because I believe it is Sarah or Kara who asked us a question of the venue of the side events that you mentioned. So again, please do visit the African Union website and look up that program. It has most of the venues for the events that are taking place. If you are within the African Union compound and you are attending the summit, we also have the media center, and all those programs are displayed there. And if you cannot find the programs, the coordinator of our media center, his name is Mola, he's assisted by Afra, and he's working also with other colleagues. They will also be able to advise you on the venues of these events. The thing to remember, obviously, is that if the event has an opening session, then all journalists can attend that event. But if the whole thing is closed, then you will not be able to attend. So please do check on those programs. And then the last one is a message that just came through from Maneke, and he's inviting all members of the media who can attend to attend the opening session of the Africa CDC Ministerial Executive Leadership Program, which is taking place on the 18th of February at the Sheraton Hotel in Addis Ababa. And the time is 7 a.m. to start. It is a breakfast event with the heads of state. So there is an invitation going out to you to attend that event on the 18th of February at 7 a.m. at the Sheraton Hotel. All right, then that does it for this press briefing for this week. We will be meeting again next week on Thursday at the same time, which is at 12 noon East African time. For now, have a very good weekend. If you are here at the summit, enjoy your time. Bye-bye.
Recording stopped.
Let's get off.